Every community has a story, one written by the businesses that take risks, the leaders who make tough decisions, and the people who choose to invest their time, talent, and trust right where they live. Johnson County Business Insider, a new podcast focused on local economic development and the people shaping the future of our communities. Each episode, we'll sit down with business owners, civic leaders, entrepreneurs, and change makers to talk about what's really happening on the ground, what's working, what's challenging, and what it takes to build a strong, sustainable local economy. This isn't about buzzwords or theory. It's about real conversations, real decisions, and real impact right here at home. Now, meet your host, Christian Maslowski. And whether you're a business owner, community leader, or someone who simply cares about the place you live, you're in the right place. Let's get started.
Welcome to the Aspire Johnson County's podcast, the Johnson County Business Insider, where we will spotlight the people, projects, and policies driving Johnson County's growth. You'll hear storytelling, interviews, and roundtable discussions featuring business leaders, educators, elected officials, and community partners. From this, we think that you will gain insights into business, workforce, public policy, and community development around Johnson County, Indiana. Today, we're diving into employer-sponsored health insurance, why it exists, how it's changing, and how Johnson County employers are navigating one of the biggest cost drivers in business today. My name is Christian Maslowski. I'm the president and CEO of Aspire Johnson County, and I'm co-hosting here today with Angela Vanderstein, who is Aspire Johnson County's vice president of investor development and relations. We have an awesome panel today. I want to dive into it. Let me introduce our panelists. Joining us today, and they are Katie Wheeler, producer with Franklin Insurance Agency in Franklin, Matt Caras, a CPA with Compass Point CPAs in Greenwood, and Lance Clark, the Vice President of Administration and General Counsel for KYB Americas Corporation in Franklin. Panelists, welcome. Thank you for joining us.
Thanks for having
us.
So this is our first episode. Way to pick a great, lively, holiday-themed topic like employer-sponsored health insurance.
Going for the jugular,
I was
Christian.
going to say something easy.
Something easy. Yeah, that's right. Well, it's top of mind, right? It's a major open enrollment season for many employers, and we wanted to dive into this. So to keep it or try and start off light before we get into the heavy stuff here, how did we get here? What is the history of employer-sponsored health insurance? So I have a little trivia for our panelists today. So first question, employer-sponsored health insurance became common because of what major historical event?
Oh, boy. You got a hint?
Yeah, a hint. It was a major wartime
I was going to
policy.
say World War II.
Yes, that's it.
Oh,
Very good, Lance.
All right, Lance.
World War II wage controls. During World War II, the federal government imposed wage freezes to control inflation. They were hoping to avoid the hyperinflation that happened in Germany after World War I, and the Labor Board exempted employer-sponsored health benefits from that wage freeze. So, of course, employers, right, just give us the rules. We're going to figure out how to play within them, get around them. Mm-hmm. Employers offered health insurance benefits to attract and retain employees without violating those wage controls. All right. Second question. In what year did Congress adopt IRS policy that both, one, allowed employers to deduct their contributions toward health insurance as a business expense, and two, excluded the value of employer-provided health insurance coverage from the employee's gross income, cementing the system we have today? Was it 1954, 1965, or 1976? 76? The CPA says 76.
76. The government's always slow with things.
Katie, any guess?
Yeah, I'm going to join him on that.
76. Lance?
I'm going to say 65.
65. All right. Well, unfortunately, you're all wrong.
Oh, wow.
No.
It was way back in 1954. Wow. We have been living under this system for 71 years. 1954. Good guesses, though. So that's the system we have. We've inherited this system created by wartime policy, and employers have been, carrying the load ever since. So we're going to get into some discussion here. Before we do, real quick, just a quick disclaimer. Our guests today are experts in their fields. We're thankful to have them, but just full disclaimer, this represents their policy and not that of their employers, and this certainly should not be intended to be formal, legal, professional advice. Please see your professional as you're navigating this, but we're going to have fun conversation today. So let's just start off, broad lens, guys, from where you sit, we have, again, Matt, CPA. Katie is an insurance. Lance, major employer in our community. How would you describe the current state of employer-sponsored health insurance? How is it right now, Matt?
I would say it's very evolving right now. With the rising costs of health insurance, employers are having to figure out what they can afford and how they could stay competitive with finding talent to work for them.
Mm-hmm.
Yeah, I concur. I think it's an interesting time to have, I would say, an insurance agent's job. It is absolutely 100% evolving. From what I, am experiencing right now with all clearly this being a huge, topic of discussion, it's paved the road as we go, really.
Wow.
Yeah. We are going to have to shift our mindsets to create better solutions because in the grand scheme of things, sustainability with these group health programs, it's going to be a real challenge.
Sustainability in what way?
Really from a cost perspective. So, we see a lot of our smaller businesses trying to do their best to remain competitive and relevant and help, provide these options to their employees. But when you have a group that you've, been paying XYZ for premiums and then you see significant increases, sustainability of being able to continue to increase the cost that comes along with that from year to year is going to be very challenging.
Yeah. We are literally spending millions of dollars every year on healthcare. And to your point, this system has been in place for, tens of years, more than half a century.
Yeah.
So everyone's trying to be creative, but you're being creative in a box.
Yeah.
So you're kind of locked in, and you're playing around with the edges, trying to find different ways. But it is, we joked earlier about, if it was easy, anyone could do it.
Mm-hmm.
And the government's tried. Multiple different companies have tried different things, but we've yet to find that silver bullet.
Well, Lance, let me ask you. I know your company provides really robust coverage, plus an on-site, right? You have an on-site health
clinic, correct?
So, what as an employer then? What trends are you watching closely in this space?
Well, it's mostly cost and. How do we reduce costs? That was the purpose of the clinic. Putting an on-site clinic, it's not an inexpensive proposition. But when we looked at the number of employees that were going to the emergency room because they had the sniffles, right? And, we were paying those costs, looking for ways, okay, how can we, one, better serve our employees? Two, keep them at work, which ultimately is what it's all about. And three, try to reduce our costs from those emergency room, those critical care facilities. And so when we did the math, given our population, now we've got roughly 800 employees. The numbers I've seen is you would really need at least 500 employees to make a on-site clinic worthwhile. So it's not for everyone, although I've also heard about groups of smaller employers getting together, and having, it may not be an on-site clinic, but maybe it's a local clinic that they all band together to join. But that's, as I said, it's just one of those alternatives that I think every employer needs to evaluate to say, all right, is this one way that we can try to reduce our costs?
Well, Lance, I mean, you already said employers are playing around trying to figure out what works, and we've alluded to the cost of health insurance is often the second largest expense after payroll. So what strategies are employers using to navigate rising costs? What are you guys seeing?
For us, we use, as many companies do, we use an outside broker. Okay. The great thing about using an outside broker is they're not just working with us, they're working with many other companies. And so we're kind of begging and borrowing from what other people have done. So we implemented, as of last April, the spousal carve-out so that if the spouses have the ability to be covered under another plan where the other employer contributed at least 50% of the cost, so there were some rules involved, then that spouse was no longer eligible to be on our plan. It was a difficult decision. It impacted a lot of people, including a few executives that weren't very happy about it. So, I mean, it was across the board. Yeah. But, it was just one of those options that we had resisted for a long time, but finally, just for the cost, felt it was time to do that.
Yeah, and we see a lot of businesses starting to do that. Katie, are you seeing more businesses looking into that?
This is absolutely a hot topic. We have to take that approach. You start the conversation, you talk about goals, you talk about budgets, financial stability, and that all really plays a role in what options are best for these companies.
Katie, what are the employers experiencing? What are the average premium increases that employers are experiencing for their 2026 renewals?
Yeah, so I have some good examples of good renewals that we've seen this year. One being the Chamber Care Plan for all of our groups that were already participating in that. They saw the benefit of no increase in premiums for the following year. So that was a huge deal, especially in the circumstance that we're in today. But we've also seen some really steep increases in premiums as well. So an example of that would be our larger group, First Insurance Group. We saw a 30% increase in our premiums last year, and this year it was around 46% increase. Wow. So the premium for a family participating in the group health plan is $54,000 this year. Wow. So how is that sustainable?
Right.
You just have to continue to evaluate as these premiums increase. What other options there could be.
Mm-hmm. Yeah. So talking financial stability, let's talk about the financial health, of small firms. Are any tough decisions being made that you're seeing?
There are. I find that a lot of small businesses are looking at rising costs of everything outside of just health insurance and just costs of people and being able to retain those. Mm-hmm. And so I have a lot of clients that have healthy backlogs. They got a lot of work to get done, but they don't have people to get it done. And so they have to then look internally, what can we do to attract and retain new people? And some of that is by offering health insurance that they may have not offered in the past, or maybe offer better plans, offer different incentives to get those people in there. But with the rising costs, I find a lot of employers right now aren't being as interested in starting new things because they don't know what costs are going to be here 6 months from now. For their inputs for their materials and labor.
Yeah. And I kind of want to ask all of you this, and Lance, you might have some input on this. Are people more concerned about the benefits of the plan or the premium cost?
Well, it depends. Week after week, they're more interested in the premium cost.
Okay.
When they get sick, they're more interested in the benefits.
That makes sense.
So a lot of times they don't know what the benefits are until all of a sudden they break an arm or something. It's like, wait a minute, what do you mean I have to pay the first $5,000 of a out of pocket, or what does it mean of this? Oftentimes, when it comes to open enrollment, we offer 3 different plans: a high deductible plan, which you mentioned earlier, and then what we call an 80-20 plan, and then a 70-30 plan. oftentimes they're going to select the 70/30 because that's the cheapest. And then something happens and it's, well, wait a minute. I thought I was paying for insurance. Well, you are. But with insurance, there are deductibles and there's out-of-pocket and there's co-pays. And
Well, I appreciate this conversation. I know listeners are just scratching their heads, and I know a lot of employers have been struggling with this. And I guess the Affordable Care Act, we talk about large employers. Affordable Care Act in 2010 cemented large employers. I think one of our panelists mentioned that, large employers now are required to provide some sort of coverage. But if you're scratching your head, so I'm going to ask the question for our panelists, why, if it's so complex and expensive, why do employers continue offering it at all? What's the business case, Matt, as you're talking with your employers, the ones that are tackling this? What is their business case for continuing this madness?
Well, the reason to have health insurance is to hire quality talent. There's a lot of employees that is a requirement of theirs for selecting a job. It's not just salary. It's not just time off. They require either a 401k, a 401k match. They require health insurance. They require other things, and that's the reason why they may be in the workforce. And so if you don't have those options, you may not have that same quality talent that somebody else is going to provide.
That's interesting. I've never heard anyone. We've always talked about it being retaining and attracting, but Matt, you just qualified it by having high quality, right? It's not just anybody, but it's the high quality candidates.
Exactly. The high quality candidates kind of expect that. They have reached a certain level and they've been offered that from other people, that these aren't these entry level people you're getting fresh out of college, fresh out of high school. These are talented, qualified people that are wanting and demanding benefits.
Yeah, I agree that last point, but I agree with all of it. I mean, I think there's really three reasons. One is just the attraction, the retention of current employees. Secondly, you want those employees to be at work. I mean, we produce 35,000 shock absorbers every day. Well, we can't do that without the 800 people being at work. So
AI doesn't do that for you yet?
They don't. We're exploring how to use AI to build a shock absorber. We haven't gotten there yet. But then the third one is really just kind of the altruistic. It's the right thing to do.
Yeah.
Outside a government-run program, it's really left up to us. Mm-hmm. And it's the only way to keep it affordable. Because one of the things, and I'm sure Katie and Matt being professionals as well, it's all about spreading the risk. Mm-hmm. If you only insure the unhealthy people, the costs are astronomical. Right. It's like Social Security. The younger people are allegedly paying for us old guys, and it's the same with healthcare. It's the healthy people through their premiums that are really paying for the sick people. Mm-hmm. Yeah. And if you don't spread that risk amongst the healthy people, then healthcare truly becomes unaffordable for everybody.
Mm-hmm. Yeah. Really good point.
Yeah.
So I guess let me ask a question. If employer-sponsored coverage disappeared tomorrow, what would change for businesses and workers?
I mean, that's a good question. I guess it really comes down to also, the revenue code. Can you still deduct those premiums? Even if we don't sponsor them, can we still provide some sort of benefit and help to employees, whether it's by raising wages, whether it's reimbursing their costs, like maybe they need to go out on their own and we need to reimburse it. If they can do that, can I still deduct that and get a tax benefit for that? So, that's a really tough question to answer because there's a lot of other factors that go into that.
But someone would do it. I mean, some company would find a way to do it, and they're going to attract the top talent, and then someone else is going to do it. I mean, it truly is, for lack of a better word, a necessary evil because someone's going to offer it.
Yeah, whether it's, I was paying $200 a month for your insurance, and now I can't provide it, so I'm going to increase your salary by $200 a month, and you're no worse off. You just need to go find it elsewhere, I guess.
Mm-hmm. Yep. Okay. So let's talk about trends, the trends that you guys are seeing, the ones that Johnson County employers should be paying attention to over the next 3 to 5 years. Let's start with you, Lance.
I know this word gets bantered around a lot, is the whole aspect of wellness. If we can, identify one pre-diabetic, if we can identify one person with heart disease, that we can treat that before something catastrophic happens, that almost pays for our clinic. I mean, if you look at the cost of reaction, the cost of treatment, as opposed to the preventative, it's huge. So yeah, we're requiring the annual physical. We're rewarding people for walking. We're the smoking cessation, although some people would say smokers really don't cost you much now. They're going to cost you a lot more later in life, but the statistics are up in the air on that. But I think that is, I see that as the huge carrot right now, is the whole aspect of wellness and how you define that, how you implement that, and then how you try to take advantage of it.
Okay. Yeah. Katie, what are you seeing?
This is a challenging question. I feel like one thing people should kind of keep their eye out for, and something they're going to hear a little bit more about, is this concierge medicine.
What is that?
You're going to directly contract with a provider or a group of providers that are going to be able to provide you really your preventative care visits, but also see you when you have the sniffles, and then you're going to probably see, I think, some major medical plans remaining in place for, catastrophic events or major health events. So, I can kind of see that trending that direction, and I think it's very evolving and early for options at this point.
Yeah, interesting you brought that up, because I know we have seen in Johnson County a few of the concierge medicine practices open in the last few years. So, Matt, how about you? What trends?
Yeah, I think Lance nailed on the head there. Hit it on the nail of the head. Did I say that right? I think I might be tongue twisting.
There was a nail somewhere.
Yeah, there's a nail somewhere and got his head hit. But prevention is cheaper and easier than reaction. I've been in military medicine for almost 22 years now, and one of the things that we focus on is preventing injuries and illness. When you go out on a run, you should stretch first. But otherwise you pull a muscle and you could be out for a couple of weeks from being on the run again, or even a month. And so preventing is just cheaper. Yeah. Another thing I've been seeing a lot, especially in Johnson County, is I've seen a lot of wellness clinics open. I'm getting a lot of clients in that world that probably didn't exist even just 5 years ago. I'm seeing that more and more people are interested in preventing and getting ahead of things and just making their overall wellness better.
Well, listen, as we close up here, just real quick, 1 sentence, 10 words, just lightning round. What's the smartest thing a small or mid-sized employer can do right now to manage health benefits wisely? Let's just some advice for our listeners. Matt.
I would say look at your plan and make sure you're not paying for something you don't need, and making sure that you're providing the right amount of coverage for your employees to keep there.
Lance.
I'm going to stick with wellness.
All right, one word. I love it.
One word, yeah.
One word. Well, hey, listen, before we go, we talked about managing costs, and Katie, I'm so thankful you teed this one up. Mentioned the Chamber Care program. So this is in a small employer group plan. It's available through the Indiana and Indy Chambers. However, so very excited that Aspire Johnson County is now able to make this plan available to our members. And the benefit of this is it groups and it pools together small businesses so they can access group health insurance, but really take advantage of large employer rates, because you're growing that pool size. So you may have 10, 20 employees, and instead of getting underwritten in the market as a standalone company, you will get underwritten, but now you'll have the benefit of the large group rates, and there's a potential for cost savings there. And as Katie mentioned, that group has been very well managed, and they did not see an increase in premiums going into 2026. So a great option. So, hey, I want to thank our panelists. Angela, I think they did a great job today.
They did an amazing job. Thank you
very much. Matt
Crowd goes wild.
Crowd goes wild. Matt Caras, Katie Wheeler, and Lance Clark, thank you for joining us. And you know what? We'll have to have you back, and we'll have a conversation about another riveting holiday-themed topic. So we're going to take a quick break real quick, and when we come back, I'm going to sit down with the CEO of Johnson Memorial Health to discuss how the hospital's navigating this as an employer, but also how they're navigating insurance regulations as a major provider. So we'll tackle that in just a couple seconds. So again, thank you all very much for joining us today.
Thank you.
All right, thanks for having us.
Welcome back to the Johnson County Business Insider. I'm your host, Christian Maslowski, President and CEO of Aspire Johnson County. We just finished a really lively panel discussion on employer-sponsored health insurance, why it exists, how it's changing, and how Johnson County employers are navigating one of the biggest cost drivers in business today. So I'm now here with Dr. David Dunkle, the CEO of Johnson Memorial Health here in Johnson County, Indiana. The purpose of this segment is to not only explore this topic with Dr. Dunkle as a large employer, but more importantly, we want to explore this topic with him as a health provider. So, Dr. Dunkle, welcome. Thank you for joining us.
Hey, thanks for having me here. Really looking forward to being here today.
So, let's start off just a little bit to help folks get to know you before we dive into healthcare policy, employer benefits. So, you're a medical doctor. What originally drew you to medicine?
Well, honestly, it was going back. I was a high school athlete, had a great relationship with our team doctor. And I thought, here's a great way to still be involved in athletics, and also I enjoyed medicine, so that kind of put me down the path. And that's where it started.
All right. So where did you receive your medical training?
So I laughed that, I grew up in West Lafayette, but Gene Cady wasn't knocking on my door. So I ended up came to Franklin College, which was a great choice, played basketball there, and went on to medical school at IU, residency at Franciscan. I've been at JMH, started practicing family medicine in 2003. Seems like yesterday, but
Wow.
I've been around.
No. And for listeners can't see, and those of you who have not met Dr. Dunkle, yes, basketball was for sure. I think he may be one of the few folks I actually need to look up to, and I'm a pretty tall guy. So walk us through their journey from practicing physician to hospital leadership. How did you ultimately end up in the role you have now?
Well, honestly, I enjoyed. I got in pretty early. I was asked to be part of medical executive committee at the hospital after I probably been there about 3 years, and I just really enjoyed the leadership standpoint. I enjoyed the business aspect of medicine, and so I went on to take on some other leadership roles. I was chief of staff a couple times, became vice president of medical affairs, and during that time, I got my MBA with an emphasis on healthcare through University of Massachusetts. Because I really though I love medicine, I love practicing, I found myself being more attracted to medical leadership conferences. I was truly one of those people that got into medicine because I enjoy helping people, and I do, and I enjoy the interaction. But as I began to move into more leadership, I realized I was able to affect the lives of more patients with decisions that I made, and that's what propelled me down that road.
Wow.
And I'm very grateful to the opportunities I've been given and to serve the residents of Johnson County through the work we've done through Johnson Memorial Health.
Folks who aren't maybe, really familiar with Johnson Memorial Health, you've heard of it, driven by it, but just give us a sense of, the size, the services, what's the role you play in regional healthcare?
We are the only full-service hospital located in Johnson County, and founded in 1947 to take care of people coming back from World War II. So truly, serving the residents who had served in the war. And we've been here growing our services. We're a medium-sized hospital in regards to the scope. Have about just over 900 total employees. We're licensed for 125 beds. We staff about 65 right now on a daily basis, but very much looking forward to, hopefully it looks like January 19th, we'll open our new 29-bed behavioral health unit, because again, that was one of the biggest needs in our community. We've had to transfer people as far away as Terre Haute looking for mental health bed, and there's just not enough beds. A lot of people are really suffering behavioral health crises, and we need to do a better job taking care of them, and a lot of it is more beds. But so I think we really do serve a vital need here in the county. And I like people to know too, we don't skimp on quality. We have recently been named a CMS 5-star hospital. That puts us in the top 10.1% of all hospitals in the nation based on criteria such as readmissions, infections, etc. So we really worked hard that, and also just recently received a safety grade from the Leapfrog group that measures safety categories for hospitals. So if you look around the country, there's not many hospitals that are CMS 5 stars and Leapfrog A hospitals, and that's your hospital, your Johnson County hospital.
Yeah, congratulations. Wow. As an employer, we're going to start off, like many employers, JMH is facing the challenge of offering competitive benefits. You said 900 employees. You're trying to manage rising healthcare costs. So you recently switched to an individual coverage health reimbursement arrangement, an ICRA. Tell us a little bit. What is this? How does it work?
it's a much like, back in the day, even when I started Johnson Moore Health, everybody had a pension plan.
Yeah.
A defined benefit. Now it's defined contribution plan. And ICHRA is really kind of similar. And you take a step back and you look as employers, I don't choose my employees' auto insurance, their life insurance, any other insurance. It should be an individual decision. And so what ICHRA, what you do is contribute a certain amount of pre-tax dollars to the individual, and then they get to go out in the marketplace and find the plan that works the best for them and their family. Because traditionally you look at, like we have two plans. We have a PPO plan and a high deductible plan. So it's not very flexible. And so we first had heard about this. It was Rush Memorial Hospital, was one of the first hospitals in the area to have an ICHRA plan, and we started looking into it. And we did the modeling. We worked with a Indianapolis partner called Remodel Health, which is a great up-and-coming company. But 73% of my employees were going to have more take-home pay, more dollars in their pocket. And when you look, we're all facing problems with turnover. And when we really look at the turnover at our organization, it's not the people that have been there 5 years, 10 years, 15 years. It's the first year or two. And for a lot of people, it's money. And we've done things like same-day pay availability. And this is another way, I think, to put more dollars in the pockets of our employees and to let them have individual choice. And again, I can tell you for myself going through the process, it is a very seamless process. Now, I do feel bad. Again, most of my employees come out ahead. There will be a few that unfortunately will end up paying a little bit more. And again, I do feel bad about that. But again, as an employer, you have to look at what's best for the majority of my employees. And I think that these plans are gaining steam across the nation for a reason, because not only is it great for the employee, but from an employer standpoint, I can tell you in the past, we're self-insured and we have absolutely fantastic months, but that profit goes to zero because you have a couple employees that have, unfortunate circumstance. And as being a self-insured employer, we end up paying that. Not everybody realizes when they say, oh, it's an insurance company. Yeah, we have a TPA, third-party administrator, who adjudicates those claims, but we're the ones writing the checks.
Right.
and a lot of people don't realize that. They say, oh, the insurance company.
Yeah.
No, it's us. We're making the payment. But again, it helps from an employee standpoint. I know now going into 2026 what my monthly costs are. And from a budgeting standpoint, it makes things a lot easier. And then you think, too, just the insurance game as a whole, it's about spreading risk across larger population. That's how you keep prices down. And that's why, again, for the majority of my employees, we're spreading risk on these exchange plans. It actually is lowering rates. The majority of the employees, honestly, have been, at first, I wouldn't say skeptical, but there's always a change. Everybody knows change management, right? Right. But then when they actually started looking and saying, oh my gosh, this is cheaper for myself, this is cheaper for my family, a lot of positive feedback. In fact, in some of our employees who are Medicare eligible, who hadn't opted into Medicare, some of them come out the furthest ahead, because now not only do they have Medicare, which is taken at every hospital, and there's all networks, but also now with the money that their pre-tax dollars, they're purchasing those riders and that are able to keep drug costs down and whatnot. So overall, most of our employees have been very happy. Again, I do know that there are a few that this is not an advantageous plan, and I do honestly feel bad about that. But for the majority of the organization, this is a much better move.
So we flipped the conversation exactly where we wanted to go, from you as an employer to a healthcare provider. So let's kind of talk a little bit more about this. How does that mix of health insurance types, these commercial insurance providers, Medicare, Medicaid, how does that affect your financial stability as a hospital?
Well, it's difficult. And I always, again, I live it every day, but when I am out in the community or I'm talking to people that really don't understand insurance, I say, this is where you need to start to set your baseline of understanding. Medicaid, which again is mostly state-run, reimburses 57 cents on the dollar for total cost of care. 57 cents on the dollar. And I would say in Johnson Memorial Health, that's about 22% of our business. Medicare, again, that's more the elderly care, again, federal program, that reimburses 82 cents on the dollar total cost of care. So my total business is 70% Medicaid or Medicare. It's just that's the way the demographic is around our hospital. So I rely on my business for that 30%, that cost shift, which for years, I'll be honest, has been, has been just the accepted way. When I first started out, we would have contracts that were 450% of Medicare, and that's just what kept the system going. What we've seen since COVID is very aggressive, because again, I go back to COVID because you got to remember, everybody was sheltering at home. Hospitals were only taking care of COVID patients. Outpatient surgeries were shut down. You couldn't go to your doctor's office. Well, the insurance companies weren't refunding your premiums. They were still taking them. And what did we have during COVID? Record profits for the insurance companies. When shareholders get used to record profits, they expect more profit. And so what we have seen is, since COVID, incredibly aggressive behavior on the parts of, they're called payers in our realm. I like to, which is crazy because they're really just premium collection agencies because they don't pay half, as much as they should. But what we've seen is very aggressive behavior, and they're, again, winning the battle out there. You hear our state representatives talk about high hospital prices. It is not hospital. I mean, again, a hospital price, we get reimbursed such a small percentage of that. It's really kind of disheartening. So again, I'm trying to keep a profitable business going when the majority of my patients, I'm not reimbursed for what it costs to take care of them. And then for the other 30%, I'm begging the insurance companies for the care that I've already provided, for them to agree to pay me and to pay me in a timely manner.
Yeah. So you have a doctor there all day. You have patients. You see 3 patients in an hour, and there's 3 different reimbursements rates. So is that doctor getting paid less for one patient versus the other?
Yes. And here's the thing that even should irk you more. So again, we're a 5-star hospital,
right?
Leapfrog A hospital. Quality. I mean, we couldn't do much better in quality and safety. You can go to another hospital, a larger hospital. Maybe they're a much lower CMS rating, and this is for publicly reported data. So if you go to that hospital, more chance you're going to have an infection, more chance you're going to be readmitted, more chance you might have a fall. But because that hospital is larger, has more other hospitals in the state or any geographic region, because they have more covered lives, they have more negotiating power with the insurer. So they can actually get paid more than I do for providing the same level of service, the same, what we say is code. Yeah. And so that's a real problem with the system. And you look around, it's data. 40% of all hospitals in the country lost money last year. And you look at what's happened in our own state. A few years ago, Connorsville went out of business. You look at Logansport just, having to be taken over by Parkview. Rural hospitals especially, they're struggling. And you're going to see more hospitals, not just in the state of Indiana, but nationwide, either shutter their doors or have to find a larger partner to partner with. And what's scary about that is in a lot of areas, when consolidation happens in the local community and now you're being run from someone who has headquarters miles and miles away, data shows that what typically happens is quality goes down and price goes up.
Mm-hmm. So, and as an employer, right, you still have to compete for talent. Mm-hmm. And so if you're getting paid, 3 different reimbursement rates, you're not paying then the doctor's salary 3 different levels, right? You have to, so that's difficult. The panel we had on just a few minutes ago was talking about trends in plan designs and benefits and deductibles and what's included and what's not. And wellness, actually the topic of wellness did come up and preventative care. But so we're trying to get creative, and the employers, kept mentioning we're getting creative, and there's different levels of care, different levels of coverage. How sensitive is a hospital like JMH to the changes in the insurance benefit designs, the deductibles or network behavior of local employers?
Oh, very much. I mean, we're always competing for business. And the problem is, there are some narrow, people go to these narrow networks. And what hurts, JMH, if a local employer chooses a narrow network that we're not in that network. I try to, when I'm especially, I believe in a strong Johnson County, and I feel that one of the great things about the people of Johnson County is that we support one another. And that is, we talk about shopping local, and really I say it should extend to your local hospital because, again, we are a very large employer in this county, and people need to understand that when you take business other places, that decreases the opportunity of Johnson Memorial Health being able to make a profit, to be able to reinvest in the technologies, the people, the physicians, the equipment. We need to continue to provide the high-quality care that this community demands. Mm-hmm. And so I think people need to think about that. And we are very, very susceptible to changes. And that's why, though we've tried to work more directly with employers. We have an employer clinic. We're actually very close to, we're trying to get a wraparound product where we can offer a certain percentage of Medicare moving forward to be more appealing to employers. But, you start with things like primary care. Again, I'm a primary care physician. The average ED emergency department costs approximately $2,000. So statistically, if you just have primary care, for a lot of employers, if you can just get same-day primary care for your employees, you're going to save dollars because they're not going to the emergency room for that earache or because they're not established. And I'm not even talking about controlling the blood pressure or the diabetes that can cause the stroke or heart attack down the line. I'm talking just immediate savings. And so I do feel that's important for employers to realize that just being sure your employees who are on your insurance have primary care physicians, how much that can save in the total cost of care long term.
Yeah. So I just can't get over 57 cents on the dollar is what you get paid for the services you provide. Same services you provide to everybody. And then was it 82 cents for Medicare. Who sets those rates?
Well, obviously Medicare is federal government.
Okay.
Medicaid has a lot to do with the states.
Okay.
And I do feel, we haven't had a base rate, inpatient. Now, again, there's other outpatient things that have been increased, but from an inpatient hospital reimbursement rate for Medicaid, no increase in over 30 years.
30 years.
Think about that. 30 years.
Boy, what did a gallon of milk or a gallon of gas cost 30 years ago, but yet we're still paying our hospitals the same as we did 30 years ago?
And I feel, and again, I understand the pressures the state is under. And you look, and especially if the one big beautiful bill is going to put even more pressure on the states. But you can't hold hospitals like JMH responsible. I'm not the reason costs are rising so much. And you have to understand, we're open 365, 24/7. I take care of anyone regardless of ability to pay. We have to. Mm-hmm. And people don't understand how much we did over $1 million in charity care last year. I suspect with work requirements, with a cap on the Healthy Indiana plan, with other downstream from One Big Beautiful Bill, what have I already seen? Increase in charity care. What do I expect? I expect more people not to qualify for insurance, to put off seeing a physician until they have a more serious medical need, and then they're going to show up in the ED needing more advanced care. And unfortunately, a lot of times, something that could have been prevented if they just had access. Lots of times, very inexpensive medicines can make a ton of difference in people's lives.
Yeah. So, some advice for employers. What's the smartest thing that a small or mid-sized employer can do right now to help manage health benefits?
I think you got to shop around. I really do. And I feel bad. I have a lot of friends that are small business owners, and they've seen, probably getting the highest quotes for insurance premium increases next year than they've seen. I think you have to look into things like ICHRA models if you're self-insured. And if you're not self-insured and you have, you need to look into being self-insured. Because even though I think, and I've talked to some of my friends who they get a little scared about being self-insured, it's still, Anthem and United, Elevance, whatever you want to call them, they're not losing money. They're making money off the premiums. So, they build in, obviously, your premium increases. They have to stay profitable. So shop around and look at other models, I think, because you have to keep that pressure on the big insurance companies to keep their price as low as they can.
Yeah. All right, before we go, I'm going to have you participate in the same trivia. We did a little fun trivia, like how in the world, what's the history of employer-sponsored health insurance? How did we get here? Where did it start? So I'm going to see if you know some of these answers. So employer-sponsored health insurance became common because of what major historical event?
Let's see. I would say Great Depression.
Close, very close. And it actually, you said World War II earlier, close to the founding of JMH. It was actually during World War II. Federal government imposed wage freezes because they wanted to control inflation, but they said, hey, we're going to exempt employer-sponsored health benefits from wage freezes. So employers, of course, use that as a retention and recruitment tool. So, all right, in what year did Congress adopt IRS policy that allowed employers to deduct their contributions toward the employee health insurance as a business expense and excluded the value of the health insurance provided by their employers from their gross income? So that kind of cements the tax treatment that we have today. Was it 1954, 1965 or 1976?
Can I phone a friend? I'm going to go 76.
That's what our panel said too, but believe it or not, 54. We've been in this situation for 71 years. We've had this tax deductibility and exemption for 71 years. And last, and you may know this, what percentage of Americans get their health insurance through an employer today? Is it 30%, 50%, or 70%?
Ooh, I must say, well, I think it's a trick question because it's total. Is it?
Let's say working age Americans.
I'd say 70.
Okay, that's what our panelists thought too. Believe it, it's not. It's lower than that. It's about 50%. A little over. About half of Americans, working age Americans, rely on their employer-sponsored coverage. It feels like 70%. That's what everybody guessed. So, just one final quick question: what's giving you optimism about the future of healthcare in Johnson County?
I tell people as much financial pressure as there are on organizations like ours, especially smaller hospitals, it's the people that keep you going. Yeah. It is when I come to work and I see the smiling faces and I see the staff, the nurses, the physicians, the lab workers, the techs, all working to make a better Johnson County, and how serious they take it and how seriously we take quality and safety and outcomes, I mean, it does. It still warms your heart. And taking care of people is a gift. And that's, what I try to remind people of, that, unfortunately we have these external pressures, but you just have to focus on that day to day. And what we're doing is every day we're making the lives of residents of Johnson County better.
Absolutely. And we're proud to have you in Johnson County. And thank you for joining us today.
Hey, thanks for having me. It's been great.
Thank you very much. And stay tuned, listeners. Please be sure to follow along with this podcast as we roll out in 2026. And again, thank you for joining us for this inaugural episode of the Aspire Johnson County's podcast, the Johnson County Business Insider.